Hi, I'm Heather, and I am 36 weeks pregnant, and I've been seeing Dr. Summer all through my pregnancy for chiropractic care, and I haven't been experiencing back pain and just the normal aches and pains you experience while pregnant. So I wanted to interview her about health benefits of getting adjusted while pregnant. So thanks for talking with us today.
Absolutely, happy to be here.
So what are some of the health benefits of getting adjusted while pregnant?
There are a lot of health benefits. Most specifically, as you mentioned, we're able to mitigate a lot of the aches and pains that come from pregnancy. Not so much from injuries or accidents that happen during pregnancy, but just the normal body's stretching and expanding and preparing for baby. That can cause a lot of women discomfort.
Okay. Yeah, and I have noticed that with myself. I'm so thankful.
Yes.
How does it help the pelvic floor and just, I haven't been experiencing the lower back pain. There are certain pelvic floor adjustments that help with that.
Yes, so to take it back a notch, there is a technique that pregnancy chiropractors use. It's called the Webster technique, and it is the gold standard for pregnancy care. So when you're looking for a chiropractor to treat you during your pregnancy, you want to look for one that is Webster certified through the ICPA, which is the International Chiropractic Pediatric Association. And so having one that is certified, you know that they have had extra training to address those kind of pelvic floor and health issues. So Webster technique addresses the soft tissue components and the bony structures of your pelvis to make sure that everything is fully functioning, whether that's keeping the muscles balanced in length, strong on each side, and just making sure overall that everything has space to move and expand.
Okay, awesome. And speaking of space, I've heard or read a lot about how being adjusted during pregnancy can help potentially not having a breech baby. Is that true, and how so?
So it's interesting that a chiropractor doesn't actually touch baby at all. So a lot of women will kind of anecdotally say, oh, a chiropractor turned my baby. Never. We're actually just addressing those soft tissue and bony components because baby inherently knows what baby should do, right? That's kind of the miracle of birth. They know how they're supposed to be aligned. So where chiropractic can be helpful is if there is something in the way that's preventing them from turning into their ideal position. So with Webster, we're looking at those soft tissues and those bony components to make sure that everything is out of the way so that baby can turn kind of naturally on their own.
Yeah, I love that. And thankfully my baby is head down, so takes out one concern.
Absolutely.
How often should you see a chiropractor when you're pregnant?
So everyone's a little bit different, and it really depends on where you're starting from. So if you have had a lot of trauma to your body, previously, we could be dealing with some scar tissue, some kind of anatomical issues that can impact the pregnancy. So knowing where you're starting from is always helpful. But I kind of like to take it with your OB appointments or your midwife appointments. So in the beginning, we don't need to see you quite as often because, things are relatively calm. And then we get into that second trimester, things start expanding. We want to see a little bit more frequently, and then in that third trimester, preparing for birth and making sure that mama's good to go, increasing that frequency. So it can kind of mirror your typical provider appointments. But again, if you're dealing with symptoms, you definitely want to get those taken care of sooner than later. So we just take it how mama's feeling.
Yeah, and I know, especially now that I'm getting closer, I'm feeling that relaxing hormone, and it just feels like anytime I move, something wants to pop out. I'm like, I need you.
Yes.
So that's helped a lot.
Going back to the adjustment for pregnancy looking different than a regular adjustment. So you may think, oh my gosh, I have this big belly. How am I going to get adjusted? There's no space on the table. So usually a pregnancy chiropractor will have pregnancy pillows for mama to lay on because we have to have access to your spine. And the only way is usually when you are face down. So these pillows have big holes cut out of them. You'll notice that there's two. So as mama grows, we can use kind of the smaller one, we can transition to the bigger one, and then when she gets to that third trimester, we stack them both so that there's plenty of space for baby to hang in those pillows and allow maximum comfort for all parties.
Yeah. Feels so good to lay on my belly.
Yes.
After not laying on my belly.
absolutely. Everyone says, where can I get them? And I'm like, it's not good long term. You know, it feels good for the 15 minutes that you're down, but anything longer, you start to get like really sore. So don't try it at home.
So after I have the baby, would you recommend postpartum visits, and what about for the baby as well?
Definitely. So you basically just ran a half marathon or a full marathon. Let's call it a full marathon. And so, you know, even a textbook birth can still, you know, cause trauma to the pelvis, to the mid-back. You know, if you're tightening that upper body, you may have some tension in the neck. And then, of course, you're holding an 8-pound, you know, roughly 8-pound baby that can feel 25 pounds at the end of the day. And so we want to make sure that everything has been cleared out of mama so that she has just the most comfortable postpartum experience, or at least a better postpartum experience. And then the same thing for baby too, right? Even a textbook birth is still a lot of pressure on their heads. If there's any kind of pulling that has to happen coming out of the birth canal, you know, that can put some traction on neck. If they've got an arm stuck or a leg, that can also have an impact on baby's function as well. So getting a nice gentle check afterwards, making sure everything's aligned, so that way when they're rapidly growing these next few months, that they're on the right path.
Yeah, and I remember with my firstborn, his labor was a little, or more so the pushing was a little longer than with my secondborn, and he kept wanting to use like one side of his body. And so it makes sense
absolutely.
that chiropractic care would help with that.
Absolutely. And a kiddo adjustment, if you have never seen one or experienced one, much different than an adult, right? Their joint spaces are very, very large. They don't have the muscular structure that an adult person does. So I always say it looks more like a baby massage, and it's just those very light pressure kind of massages and movements that we're using to adjust baby.
Yeah, it looks very glamorous from what I've seen. I adjusted my first and second. My first cried because that's his personality. My second one was like, this is nice.
Yes.
This is like a massage.
Absolutely. Yeah. So the goal is always, you know, to adjust at rest, keep them comfortable, but sometimes they don't like it. Stranger danger.
Yes, exactly. Cool. Well, thank you so much for talking with
Absolutely.
us. This is always really informative.